Hello, loves. I don't know if you can see me. Oh, why is it so dark? The lights are on. I don't understand. Anyways, I told you guys, since I didn't have it in the vlog, that I would do an update video on what happened at my doctor's appointment today. And it's not, well, I will give you the good news first. The good news is that my lupus is in remission. At this point in time, we don't know if it's in remission because I took the prednisone or if it's just in remission to be in remission. We're not sure. But it is in remission as of right now. The bad news is that my sugar was high, and that could have been because of the prednisone. We don't know. Or it just could be my sugar's high for some odd reason. The other bad news is I am having, the reason why I had my blood draw today was to have my thyroid checked because there's something going on with my thyroid. It's being hyperactive. So they're checking my thyroid to see what's going on with that. In which case, when they find out, then I will know more about what I'm supposed to do. Also, I have to have vitamin B12 shots. Here's my little band-aid. I have to have vitamin B12 shots every month now. And I found out that I have rheumatoid arthritis. And my rheumatoid arthritis is very extreme. They go on a scale from 1 to 18. And I am at a 14. Which is not good. Again, I'm sorry that it's dark. I don't know why it's so dark tonight. I would turn on a flashlight, but un momento. I'm gonna turn the light on. Can't see me.
Great race for great ride. Geico Motorcycle.
Okay.
See how much you could save.
Oh. Okay. So anyways, yes, I have rheumatoid arthritis, and that is what is explaining this lump. I don't know if you can see it. I have a lump right here on my hand, and my thumb is twisted weird. That is called a rheumatoid nodule, and that is why I have that. I was wondering about that, and I wasn't sure. And also, well, I will just read you the paperwork because that is the best way to explain to you guys what rheumatoid arthritis is if you don't know. Rheumatoid arthritis is called RA for short, and it's a chronic disease that causes pain, stiffness, swelling, and limitation in motion and function of multiple joints. I do have limited function in my right shoulder now. I can't lift it as high as my other one. If left untreated or improperly treated, RA can produce serious destruction of one or more of your joints, which frequently leads to permanent disability of said joint. Though the joints are principal body part affected by RA, inflammation can develop in the other body organs as well. What is the cause of RA? RA is classified as an autoimmune disease in which certain cells of the immune system malfunction and attack the healthy joints. While the cause of RA remains unknown, exciting, rapidly advancing research is revealing the factors that are more important in producing inflammation and giving us better Understanding of the genetic factors that may be involved in the disease. As a result of this work, new medications have been developed and specifically block certain reactions in the body that are important in causing symptoms and joint damage of RA. And these medications are useful additions to treatment available for RA. More than 2 million Americans suffer from RA. Most, about 75%, or 3 out of 4 patients, are women. The peak onset is between 20 and 45 years of age. Those of you who don't know, I am only 29. I will be 30 this year. So to find out that I have RA now, and it's severe, was not what I wanted to hear today. What are the symptoms of RA? Pain, stiffness, swelling, redness, and difficulty moving the joints to full range motion are most commonly reported. Hold on, my dog is eating a plastic bag. Really, Panda? Sorry about that, guys. The stiffness seen in active RA is typically worse in the morning and lasts anywhere from 1 to 2 hours in the entire day. This long period of morning stiffness is important diagnostic clue, as not many other arthritic diseases behave this way. While RA can affect just about any joint, some joints, especially those in the hands and feet, tend to be involved more frequently than others. This produces a pattern of joint disease that the rheumatologists regard as a characteristic of RA. In addition to the above complaints, other symptoms can occur to RA include loss of energy, which would explain why I've been absolutely exhausted anymore and just want to sleep. Low-grade fevers, which I do have. My dog is pulling my blanket off. Loss of appetite, which... Would you stop pulling on my blanket? Really? You're being destructive, child. She's being destructive. Loss of appetite, which I have had. Dry eyes and mouth producing condition known as Sjogren's syndrome, which they are going to be checking me also for, because of I do show signs of Sjogren's syndrome, and it does run in the family. And soft skin lumps in the area such as elbows and hands called rheumatoid nodules. That would be this right here on my hand. And how is RA diagnosed? RA can be difficult to diagnose because it may begin gradually with subtle symptoms. Many diseases, especially early on, can behave similarly to RA. For this reason, patients suspected from suffering from RA should be evaluated by a rheumatologist, a physician with the necessary skill and experience to reach the precise diagnosis and develop the most appropriate treatment plan. The diagnosis of RA is based on the joints. Additionally, certain laboratory abnormalities such as anemia, low red blood cells, a positive rheumatoid factor, and antibody found in approximately 80% of RA patients, and an elevated erythrocyte sedimentation rate, or SED rate, a blood test that most patients with RA tends to correlate with the amount of inflammation in the joints, are commonly found in RA and are utilized by physicians as progressing. X-rays can be very helpful in diagnosing RA and is useful in determining the disease and progressing. It is important to remember that for the majority of patients with the disease, especially those who have been symptoms for 6 months or less in the duration, there is no single test, whether the blood or X-ray, which confirms the diagnosis of RA. Rather, the diagnosis is typically established when physically, skillfully combined with the appropriate symptoms, physical examination findings, laboratory tests, and X-rays. I am having an MRI done soon. I have to call tomorrow and set it up on my back. to see what's going on with my back. Because I'm still having problems with my back, and it should have been healed by now from the slip disc, and it's not. I'm still having pain. So I have to have an MRI done. And as of right now, my doctor says I can still work, but if my back MRI comes back negative, I may have to quit my job and stay at home. I'm not going to get into the treatments of RA because honestly I just don't want to talk about it. But basically they will start with trying to give me high doses of ibuprofen or naproxen, which I've already done. And naproxen and ibuprofen do not help the pain. The next thing they're going to try would be corticosteroids, which would be prednisone. Again, I don't want to be on prednisone because the prednisone gave me thrush last time, and I just don't want to go through that again. Which they are actually giving me another medication for the thrush because it is still in my throat because of the dang prednisone. And so they're going to give me a pill to clear it up the rest of the way. I have to pick it up sometime tomorrow from the pharmacy. And I actually have to call my doctor and make sure she called it in my other prescriptions too, because they're giving me more muscle relaxers and more volume to help with the pain until they figure out what exactly our plan of action is going to be. I have to go back in 3 weeks to see the rheumatologist again, and hopefully by then they will have the results of my MRI for my back. And the MRI, they are checking for a degenerative spine disorder and one other disorder that I can't remember what it's called. But basically they're checking to make sure that I don't have severe inflammation of the back from the rheumatoid arthritis, and they're also making sure that my discs are not deteriorating. If my back is not doing well, then they are going to suggest that I stop working because I do a very physical job. Until then, I can continue to work. Basically, if the pills that they give me don't work for the RA, then I will have to go into, it's almost like, I guess you would describe it almost like, I guess like chemotherapy, I guess you would call it. Basically, you sit in a room and you're hooked up to an IV and they pump you full of corticosteroids, which would be like prednisone. They pump you full of that. And it's supposed to help with the pain and help to alleviate the inflammation that is caused by rheumatoid arthritis. Unfortunately, because when they caught the rheumatoid arthritis on me, I am already at a 14, which is pretty severe. So I don't know what they're going to do from there. They have to check my thyroid. They will not be keeping me on the volume for very long. They're keeping me on it long enough to see what they can do for other things, and then they wanted to put me on something else for my anxiety, and I really was not very happy about that. Cookie did stay with me for the entire appointment, and she was there for support, and then afterwards I had to go over to the hospital anyways to try and schedule the MRI, so I went with her for her blood draw because she needed one done too. So thank you, Cookie, for all your support, and thank you for sitting afterwards and talking to me for a little bit to make sure that I was okay, and thank you for all of everything you've been doing. This is a really rough time for me, and I'm trying to hold it together the best that I can, and all I keep thinking to myself is, I guess the way I'm staying positive is the fact that I know that my lupus is in remission. But honestly, my doctor told me she would rather have lupus than rheumatoid arthritis, both of which are autoimmune deficiencies. So, yeah, this is our pillow talk for tonight. You know how I do my little pillow talks at night and try to give you guys an update on what's going on. And I'm really trying not to, like, get emotional about it. It hasn't fully hit me yet. I'm still processing it in my brain. I did already explain this to my boss. I haven't talked to the girls at work about it yet, but that's because I was just tired of calling people and telling them what was going on, because I wanted to call my dad, and I had to call my mom and let her know what was going on, because they wanted to know how my appointment went. So I go back, I have to schedule my MRI, and hopefully they will get me in soon for my MRI. I have to get in as soon as possible. And then, in 3 weeks, I go back for another B12 shot and to go over the results of my other blood tests. And, really, Panda, you're dripping all over my legs. That's gross. Stop. I go back for, to go over the results of the MRI by then. And then we'll know more about the course of action of what we're going to take. And in 6 months, they're going to do another panel of the long, drawn-out 16 vials of blood again to check on my lupus to see if it is staying dormant or if it becomes active again. So this is going to be a long, drawn-out process, and all we can hope is that my body responds to treatment well and doesn't go downhill quickly. All I'm going to do is try to keep as positive as possible and try not to be too emotional about it. So if some days I don't get a vlog up on time, or I just don't vlog that much, or that I seem that I might be loopy or just in a bad mood, now you guys understand why I'm in pain so much. Because honestly, I didn't know. And I wish that it was better. I wish I could have given you guys better news about my doctor's appointment. And I wish that it was better. And I'm not telling you guys so you'll pity me. I'm telling you guys because I told you guys when I started doing the daily vlogs and when I started doing my YouTube that I would be open with you guys as much as I possibly could. This kind of stuff I'm open with sharing with you guys, just so you know what's going on. There are still personal things that I will not discuss on YouTube, and I know a lot of you understand that, and I'm thankful for you. And I'm thankful for all of you guys and all your love and support that you have given me, and every kind word that you guys have sent me for anything. If I have a cold or anything, you guys are so sweet and so nice about it. You guys are absolutely wonderful. And don't worry, guys, I'm going to stay positive. I'm not going to let this beat me. I'm going to keep going, and I will keep you guys updated as much as possible. And I will be doing a vlog tomorrow. I don't know how much of a vlog, because I do have to go to work. But tomorrow is Logan's first day of kindergarten, and I'm going with my husband to drop him off. I will not be vlogging that. And that is just for protection of my son. So you guys don't know what school he goes to. Or where you know. So you don't know. I'm sorry, there's just some weirdos and creepers out there. So I will not be vlogging that. But I'm sure you guys understand that. But yes, he starts his kindergarten tomorrow, and I'm excited. This was my first time school shopping with him. It was so exciting. Me and John just kind of looked at each other and we're like, it's our first time school shopping for our little boy. It was just so awesome. And it's hard to believe he's in kindergarten already. And next year, Caitlin will be in kindergarten, and Logan will be in first grade. It's so hard to believe. But when I know more results on things, I will let you know. And I hope you guys are all having a wonderful night. And I'm sorry this was a longer video. It was longer than I had expected it to be, but it was a lot of information. It was a lot of information to me to take in. And my sugar was high for some reason. I don't know if I said that. I can't remember if I said that or not. There were a couple little tests that showed that my lupus was still there, which means that it is in remission. It's not gone. My lupus is not gone, it's just in slight remission. The thing about lupus is sometimes it shows up in your blood test results and sometimes it doesn't, so it's hiding, and that's why they call it the disease in disguise, because sometimes it just hides. So I plan on now making another shirt in respect to all of you that do suffer from RA, because I understand now what you guys go through. I actually have a couple friends that also have RA that I now believe my husband's throwing cheese or crackers on my back so the dog will eat them off my back. I live in a crazy house. But, alright guys, well I'm gonna go for tonight, and this will end. I just got hit in the head with a cracker. Where did it go? Poochie. 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 Alright guys, well, my dog has decided to tear out her entire toy box and destroy my bedroom, so I'm gonna go for the night. And I hope that you guys enjoyed this video as much as I can. I'm going to attempt to do Silly Saturdays with Cookie this weekend. If by chance I can make it to her house, I will do it. I do have a family function though at 5 o'clock. And I'm still trying to work that out with my husband on how to get over there and do it. So if I can, I will let you guys know. But if not, I will try to do it the following weekend if I can. The following Sunday, actually. Wait a minute. Is the following Sunday our photo shoot? It is. So actually, maybe I should just spend the night at Cookie's house, because the following day is our photo shoot and we have to go to do our photo shoot. I'm going to have to discuss that with my husband. So, now I have to make plans and stuff like that for our photo shoot and stuff like that, so. And I have to get up very, very early, and it's very, very late now, and I'm up way later than I should be, and my volume is kicking in, as you can probably tell, because I'm getting the glossy eyes, and I have to get up early for work tomorrow. And tomorrow's going to be a rough day, because usually what happens is I go to my doctor's appointment on a Monday, and then Tuesday, while I'm at work, I process what just happened. And that's usually when, because I have downtime at work, I have time to think while I'm doing my job. And that's usually when it processes, and that's usually when I break down. So hopefully tomorrow will go well, and I won't think about it. But I will try to vlog as much as I possibly can tomorrow, and I will let you guys know about Silly Saturdays. And Sunday is our photo shoot. Yeah, I believe it is a Sunday that's our photo shoot. I'm so excited about that. But anyways, I'm going to go for now, guys. And I hope you guys have a wonderful night. And thank you for your love and support. I love you all. Poodles.